Good afternoon or good evening. I'm Jackie Taylor. I'm President of the Royal College of Physicians and Surgeons of Glasgow. And wherever you're joining us from, a very warm welcome to this international webinar on COVID-19 and vaccination. And I'm very much looking forward to sharing experiences from around the world and learning from each other, something that the medical profession has always been very good at doing. The COVID-19 pandemic has been likened to a storm, and I think that's a very good analogy, and it's a storm that is still very much raging around the world, with waves waxing and waning in different countries at different times. I think currently we're all very sensitive to the challenging times that our friends and colleagues, particularly in India, are facing, and the humanitarian emergency which is unfolding. But the difficulties faced by our colleagues in any country are our difficulties too, because we are a global community. As Tedros Adhanom Ghebreyesus, the president of the WHO, says, no one is safe until everyone is safe. And we do have a responsibility as global citizens to work together to overcome this global problem. We're fortunate today to be joined by three excellent speakers from Egypt, from India, from Pakistan, and I'm very much looking forward to listening and learning from them. It's now my pleasure to introduce the chairs for the webinar this afternoon. Dr. Antonia Ho is a consultant and senior lecturer in infectious diseases here in Glasgow with major research interests in influenza and SARS-CoV-2, and Professor Hania Tiba, who's Professor of Cardiology and Associate Medical Director at the Golden Jubilee Hospital here in Glasgow, and he's also our International Director in the College. So without any further delay, I am happy to hand over now to Tony and Hani. Thank you.
Thanks very much indeed, Jackie. That's really a great introduction to what's promising to be a fantastic opportunity to share experience from great countries in the front line of COVID pandemic. In alphabetical order today, we have Egypt, India, and Pakistan represented by three eminent speakers, and they will cover for us the international perspective of the COVID vaccination. It has been a great euphoria when we received the news about a number of vaccines that's available for us to use nationally and internationally. Nonetheless, the vaccination program faced a lot of challenges, and we see around the world that the euphoria is tempered by realistic issues that is now in front of us, feeling that we have major obstacles that we need to overcome. The landscape today will be described in each country, and we will hear about the challenges and about the opportunities, and we also will hear about what we all need to hear. So national perspective, what is the approach for effective vaccination? And also importantly, we hear a lot about the vaccination hesitancy. People in different cultures view the vaccine differently. And obviously, we will hear with interest the challenges, opportunities, and the lessons that each country will share with us. Without overdue, I'm passing to my friend and colleague, Tonia Hu, to run the webinar and introduce the speaker. Tonia, floor to you.
Thanks, Hani. It's my pleasure to introduce our first speaker, Professor Wagida Anwar, who is a professor in the Department of Community, Environmental and Occupational Medicine at Ain Shams University, based in Cairo in Egypt. She's worked all around the world in Europe, North America and Asia, and has been the General Coordinator of Health System Improvement Programs in the Ministry of Health in Egypt since 2014. So Professor Anwar, I'm going to hand over to you to present the kind of COVID situation in Egypt, the government response and vaccination program. Over to you.